Good afternoon, Chamber members. For those of you I have not met yet, I'm Sabrina Binkley, Head of School at Spruce Tree Montessori and Chair of the Fairbanks Chamber Board of Directors. I'd like to take a moment, as we do each week, to thank our executive partners whose logos you saw on the screen before we began our program today. These businesses really provide a rock-solid foundation for the Fairbanks Chamber to be successful throughout the year. Their support is not only financial. These businesses share knowledge and experience that help shape our advocacy efforts and creates awareness that really drives economic strength and growth for interior Alaska. A full list of our executive partners can be found on our website. We'd also like to give a special thank you today to Sunrise Bagel and Espresso for sponsoring today's presentation. We are so grateful for the continued support of our member businesses to help us make these live weekly presentations possible. We'll hear from them a little later in our program today. And now I'd like to ask Brenna to come online to help us recognize our new and renewing members. Brenna?
Thanks, Sabrina, and welcome everyone. We have 3 new members to welcome today, and those are Access Alaska, which is a nonprofit organization that helps provide independent living services to older Alaskans and those experiencing disabilities. We'd also like to welcome Red Raven CBD, which is Fairbanks' newest CBD provider, and they're here to help you with your new wellness and health resolutions, as well as just to feel good. And our 3rd and final new member for this week is Sassy Scoops. You'll find them located near downtown across from Golden Valley Electric Association, and they create unique small batch ice cream. It's delicious. I tried it for myself this week. We'd also like to thank our renewing members, starting with F&H Fitness Studio, Sands Accounting Services, and Glacier State Moving and Storage. Thank you for renewing your membership. We'd also like to thank and welcome a new member to our 110% Club, which means that this member gave above and beyond their normal annual membership dues to help us with our advocacy contributions. And that is Valley Village. So thank you for going above and beyond your membership to help us. In today's membership minute, I'd like to focus a little bit on something that we're all very familiar with this time of year, and that's sales and deals. So this is just a reminder that if you're having an upcoming sale or want to offer a deal to the community or other fellow chamber members, you can post that on our website as well as in our newsletter. You can post it through your member profile, and if you don't remember how to get into that, you can contact me for your login info, or you can send it to me and give me a little bit more detail so I can help you post that and make it really appealing to people that want to participate. This is also a reminder that if you have an event coming up, along with that fun deal, you can also post that on our event calendar to make sure that makes it to our website and into our newsletter. So don't forget, it's that time of year where you're going to be seeing a lot of those sales, small business Saturday shopping deals, and make sure to include your outreach and marketing programs with the Fairbanks Chamber so we can help you promote those to the best of our ability. Back to you, Sabrina.
All right, thank you so much, Brenna. Good to hear all of that. So today's board chair report includes a glance into 2021. Yesterday, our board of directors met and we accepted all of Chair-elect Angie Tallent's nominations for her appointed directors, committee chairs, and committee members for the 2021 year. The board also approved the 2021 operating budget. The board approved our 2021 advocacy agenda as well. And one thing I thought I'd share from the meeting yesterday, which ran about an hour and 35 minutes, was a comment from one of our newer board members. This was the first time this board member had seen the processes for how the organization develops and decides on the issues and focus areas for which the chamber advocates annually. This board member shared appreciation for the effort and discussion through this process and highlighted how, from a general membership perspective, it's sometimes hard to know how much energy and discussion is really poured into the process. This is a good time to remind our members that you're welcome to attend committee meetings or board meetings as a guest anytime to see how our decisions really take shape and how perspectives are shared among board members. Just reach out to chamber staff to get connected with us. So this week's reflection naturally takes a give thanks tone. I love seeing gratitude within our community each November, each year, and I wanted to give a shout out to the chamber staff who organized the Veterans Day positive protest on the Veterans Bridge last week here downtown. It was wonderful to see everyone out and supporting our veterans. But especially this year, and with the holidays upon us, and with our various commitments to our families, our friends, our businesses, and our work, the idea of practicing gratitude is more and more at the forefront of what I do and likely what you do too. So I thought I'd share a funny story and a quote today. So the most recent gift I gave someone was a waffle maker, waffle mix, and a jug of maple syrup. This was to a college student, a friend of ours, who had house and dog sat for us for a long weekend about a month or so ago. So my family, 2 boys, and my husband joked that it wasn't really that cool of a gift. He could just buy that for himself, Mom. And I was told, why didn't you get him this or that? And each of them had a different suggestion. I simply explained that this was not a gift, but an act of gratitude. And that kind of blew their minds. So for the better, I hope. So I'll leave you with this quote, which seems so telling of the new perspectives we've gained as we live through the uncertainties of this year. A quote by Aesop: "Gratitude turns what we have into enough." And with that, it's time for Marissa's President and CEO report. Marissa?
Awesome. Thank you so much, Sabrina. What a great segue for us to come and talk about the annual membership and awards meeting that we're going to host on December 8th. This one will be coming to you, of course, live from our brand new but interactive platform that we're going to be using for this event. It's called Hop In. So there's a lot of exciting opportunities for us to connect with each other, to network with fellow members, for sponsors to showcase themselves in an expo style format that is online, and also for sharing multimedia presentations and really talk about and celebrate all of our accomplishments in 2020. So with this new platform, of course, there's going to be a couple of extra steps to getting registered. So please be patient, but go to fairbankschamber.org. Click on the annual meeting banner and then follow the directions. If you have any questions, don't hesitate to reach out. You can contact Katie or really anyone here on the staff, and they'll help you if you find any stumbles along the way. So make sure that you grab your tickets early, as we are doing things new this year. So we want to make sure that we have plenty of time to be responsive. So we're asking for our members to please grab your tickets by December 4th. Tickets are $25. It does include lunch. You're going to have to go and pick it up yourself before the event, but we promise it'll be worth it. There are still a couple of sponsorship opportunities for businesses if you want to showcase and highlight your business. The sponsorship opportunities range from $500 to $1,000, and you can let Katie or I know if you've got any questions about that. Also, time is ticking away for nominations for the Chamber's annual awards. So we've got nomination forms are due actually on this Friday. So make sure you get those in. And I just wanted to do a quick recap of our awards this year. We have the Bill Stroker Business of the Year Award, and that is an award that honors the accomplishments in the business community of a member of the Chamber who has shown drive in leading local development with their sights on the future of Fairbanks. So this is a business that's going to be recognized for consistent community involvement, excellent business reputation with the public, and as a leader in their own profession or their field of business. Next up, we have the George Nurbas Volunteer of the Year Award. This is an award presented to a member of the Chamber who has distinguished themselves as an outstanding volunteer. It's the Chamber's most visible recognition for volunteer contributions in our community. And all employees of Chamber member businesses and organizations are eligible to receive this award. Also, I want to note that it's not only for individuals, it can also be given to organizations. And then last up, we have the Bernice M. Joseph Education Advocate of the Year Award. And this is to highlight a business or individual in our community that has consistently shown a commitment to education through sustained partnerships, outreach, or career development opportunities that improve the educational experience of students and demonstrate partnerships through innovation and creativity. Again, all employees of Chamber member businesses are eligible to receive this award. So if you know any individuals or businesses that fit for any of these categories, please make sure to get them nominated by the end of the day on Friday the 20th. And I just want to remind everyone that last year we revamped the application or nomination process. It's very slick, it's clean, it's quick, it's efficient, gets us what we need to know. And then next, I just wanted to let folks know that we are closing up week 5 today of our Around the Town in 80 Days campaign, which means tomorrow kicks off week 6. And since you're joining us here live today, I'm going to give you a sneak peek as to where you can go in week 6 to get qualified for our Alaska Airlines tickets drawings. So in week 6, starting tomorrow, you can go to Dateline Digital Printing, Euro Style Grocery, McCafferty's, a coffee house, Kids Closet Connection, and Hotshot Sisters. So don't forget to use the hashtag 80 Days of Local on Facebook and Instagram for chances to win more fabulous weekly prizes. And make sure that you save your receipts from each of those featured business purchases that you make so that you can be entered into the drawing for Alaska Airlines tickets to be used in 2021. You can find details about all of these events and more at our chamber website, fairbankschamber.org. Thanks. Back to you, Sabrina.
Okay, excellent update, Marissa. Thank you so much. So now for our main presentation. So from early in the year, the Chamber has been proud to partner with the local healthcare community here in Fairbanks to provide a platform to not only help amplify their message, but to provide cautious updates. With numbers on the rise, not only locally, but on the state level, we must remain diligent with our COVID-19 precautions and safety measures. Though we aren't excited about our current COVID numbers, we are pleased to have with us today Dr. Zink and Dr. Laura Brunner, and I'd like to express my deepest gratitude to both of them for not only taking the time to be with us today, but for their commendable care and concern for the health and wellness of our community. Ladies, thank you so much for being with us today. Dr. Zink is the Chief Medical Officer for the State of Alaska Department of Health and Social Services. Dr. Zink has 13 years of experience in emergency medicine and joined DHSS from the Matsu Regional Medical Center, where she served as the Emergency Department Medical Director from 2010 to 2018, and also on the Board of Trustees from 2012 to 2018. Dr. Zink is a practicing emergency room physician who is passionate about helping to shape and transform our current healthcare system. In all the work she does, she strives to create work environments, policies, and practices that are data-driven, foster collaboration, and build system efficiencies that put patients first. Her priorities as CMO include building stronger partnerships between DHSS and Alaska's healthcare providers and providing support statewide in locally relevant ways to help establish healthier communities across Alaska. Dr. Zink received her medical degree from Stanford University School of Medicine and completed her residency at the University of Utah. Dr. Laura Brunner has been a board-certified pediatrician at Tanana Valley Clinic since 2009 and is the medical director for the Pediatrics Department and the Neonatal Intensive Care Unit at Fairbanks Memorial Hospital. Homegrown, Dr. Brunner grew up in Fairbanks and returned home to practice medicine. She received her medical degree from the University of Minnesota Medical School and a BS from the University of Minnesota College of Biological Sciences. She did her internship and residency at Children's Hospital of Colorado. Dr. Brunner is married with 2 children and enjoys reading, cooking, and the outdoors of Alaska. Thank you so much, Dr. Zink and Dr. Brunner, for joining us today. The floor is yours.
Great. Thank you so much for the warm introduction. And I will always take the opportunity to be someplace with Dr. Brunner. So super excited to have her here as well. And, just to kick off what we're going to talk about a little bit, Sabrina, I just wanted to bring it back to what you were talking about with gratitude. And, I just want to express my heart thanks and gratitude to the businesses communities. This has been an incredibly challenging year. I love the fact that we're talking about 2021, which I think is going to be a very different year than 2020. And we've had many, many challenges throughout this year, and you have been so creative in the ways that you have found to flex and respond and be able to deal with the challenges. If there's one thing I want you to take away from this message and from our presentation today, is that the virus is the enemy and not each other. And our tools are here to help keep your staff healthy, to keep your businesses open, to keep economy growing. I think that the creative work we see is kind of the definition of capitalism, like using the tools and resources we have to be responsive. But we also need to recognize the limitations of this virus, its highly contagious nature, and what ways we can move forward. So with that, I have a series of slides that I thought I would very briefly go through. I really want to make sure that we have as much time as possible to answer your questions, because we learn a lot hearing from you directly, and want to make sure this time is useful as possible for you. So with that, I think we could bring up the slides. It looks like we're on the first one. And so I'm just going to kind of go through these slides fairly quickly. I tend to talk quickly, so I'll try to slow down a little bit, but I appreciate everyone's time here. Moving on to the next slide, you all know that the cases are increasing across the country. This is a graph that shows the cases since the beginning of the pandemic to now. You see that first wave that might be a little bit hard to see on your screen. That's really when New York got hit hard, New Jersey. That second wave is when the South really got hit hard. The blue line is Alaska's lines. Don't pay attention to that blip that goes up. This is where they got some inaccurate reporting and data from the way that they were getting our database from. But you can see that the entire country is on this third wave right now. 98% of jurisdictions across the country are surging currently. No one's on a downward projection in the US, and 2 jurisdictions are flat. So that's very concerning that we have 98% on the upward projection. We are seeing hospital capacity across the country being limited, with people having to go multiple states over to get patients the care that they need. And we're starting to see significant limitations in the ability to access normal resources and medications across the country because of this. We're also at an all-time high for the number of nurse available positions because as staffing starts to become more tight and limited in the country as a whole, this affects all of us together. So you can see where Alaska's at. We are definitely kind of in the top third of states compared to the rest of the country. We are not at the top there. The YK Delta region right now has more cases per capita than anyone else besides South Dakota and North Dakota. And so they and Anchorage really are surging quite a bit right now. But we know that when it affects one place, it can affect all the places, as there's a lot of movement and people traveling between areas. And so we want to be mindful of what that looks like. Moving on to the next slide, unfortunately, our entire state is red at the moment. So this is greater than 10 cases per 100,000. We have approximately 70 cases per 100,000 right now in the state. I kind of never thought we would reach quite this level. And unfortunately, we continue to be on the upward trend. What we really see is the majority of this is happening in community transmission. And so it's when people are close to loved ones or family and friends and they let their guard down. And so they may be wearing a mask while they're at work, but then they go in a break room and they hang out with someone else, or it's a group of people that they volunteered with. We know that a mask plus distance reduces transmission by at least 70%. And so if we could think about what this graph would look like, if we could add those 2 things, it would make a tremendous difference in our ability to slow the spread. But again, it's in those kind of close interactions that we continue to see the spread quite quickly. This next slide looks at the percent positivity for the Fairbanks specific region. So you can see there's been a couple spikes and peaks up here. We see a lot more variability the smaller the community is, but Fairbanks has had kind of these spikes and peaks depending on kind of availability and testing. You can see that it kind of spiked up near 10% and then has been coming down. I was hoping it was going to keep going down further, but we're kind of looking like we're plateauing a little bit there. And a couple of things about that. The sooner someone can get tested for their symptoms of COVID, the better off we can stop transmission. So if it takes us 6 days from the onset of symptoms, by the time we contact that person and they contact their contacts, a lot of our contact tracing is out the door. It doesn't make a big difference. So we really need people to be tested at the very beginning of symptoms. And it's crazy how many times you talk to people and they say, I just thought this was a cold. I just thought that my runny nose. I thought this was my traditional allergies. And unfortunately, it can be very, very mild at the beginning. And what happens is a lot of the viral spread is before someone gets symptoms or right at the beginning of symptoms. And I'll talk a little bit more about that in a second. Moving on to the next slide. This is a little bit of what we're seeing within the hospitals overall. I'll let Dr. Brunner talk more at the end about kind of Fairbanks specifically. This is what we call surveillance data, syndromic surveillance data. It looks at how many people are presenting to the emergency department with kind of cold-like illness or influenza-like illness. The blue lines is COVID-like illness. The yellow lines is influenza-like illness. So you can see that there's been this real uptake in the number of people presenting. It's pretty palpable when you're in the emergency department. It was a couple cases, and now you're like, 50% of who I'm seeing, 75% of who I'm seeing are COVID-like. I think the most heartbreaking thing for me working in the emergency department is how many people I get in who say, you know, I just thought this would be a cold. I just thought I would be fine. And now they're struggling to breathe and we're admitting them to the ICU and putting them on a ventilator because they're really struggling. And these are young, fairly healthy people for the most part. Most people do really well. Most people have very mild symptoms, but there's definitely a subset that can get incredibly sick. And we want to keep people healthy and active so they can be a part of the business and the shopping and be there with their family and loved ones moving forward. You can see the yellow is influenza-like illness, and you probably can't see it on your graph, but there's a very tiny dotted line at the very bottom, and that's actually confirmed influenza cases, which are essentially non-existent. We've had a couple in the state of Alaska as of yet, but we're not seeing influenza circulating through the state. It doesn't mean that you shouldn't get a flu vaccine. It's still a great time to get a flu vaccine. We need to do everything we can to keep the capacity in the state and people healthy and active. We have had a 22% increase in flu vaccine this year, but we still are one of the lower states for flu vaccine. So make sure you get yours today. The thing that's keeping me up at night is our hospital capacity. And so while we have these cases surging and most people do really well, it doesn't do well for everyone. And we are increasingly seeing capacity stretched thin. Bethel Hospital was running out of oxygen. We've asked for a DMAT team, a federal resource team that's going to be deployed out to the YK region to help them with staffing. Fairbanks Memorial has had to accept patients from Bethel because they're very full. We used to see most of the patients concentrated in the Anchorage area, but now we see everyone from Seward to Anchorage to Fairbanks holding COVID positive patients and stabilizing them. We increasingly see staff affected by COVID. The Hospital Association put out a press release yesterday saying they have about 500 staff currently out because of COVID. And this is becoming really challenging to staff. So this isn't just the person who needs the hospital for COVID-like illness, but it's the kid with appendicitis, and it's the family that was snow machining, and it's the grandpa who has a heart attack. Like, we need to be there for those people as well. And what's happening is our hospitals are becoming very stretched thin. And as this continues to kind of circulate around the country, I think this is going to get worse if we don't all be able to pull back. The other thing too is prevention is the best way to build up capacity, because if you don't have people coming in, we have a lot more capacity within the system. But also, prevention is a fantastic way to keep you healthy as well. So sometimes we might have the bed and staff, but it's the oxygenation that's the problem, and not necessarily the bed and staffing. And so the more we can prevent the spread of this disease, the better off we are. Moving on to this next slide, this is our testing sheet. I would encourage everyone to have it and share it with your staff. It talks about what to do. So if you're getting tested because of symptoms, don't go to work, so don't spread it. It's impressive how many times we call people if they're positive and they are at their mother's house visiting a bunch of other people. And then we have a whole bunch of close contacts that have been exposed. So if someone's symptomatic, they really shouldn't be out and about, and that includes work. When to end isolation, what to do if you're positive or negative. So this is kind of some simple information. And on the back is kind of a contact tracer sheet, so that if you have an employee who's gotten COVID, you can kind of go through the definition and work through them, so that you can quickly figure out with your staff as well who may have been exposed during that time and who needs to be quarantined so they don't spread it to others. The other little picture on here has this picture of kind of what's called the viral genome, how much virus people have in their nose at a given time and when symptoms start. And the big takeaway from this picture is that your viral genome, how much virus you have, is highest right before you develop symptoms or right at the beginning of your symptoms. But then the sicker someone is, the less virus they're actually shedding. And this is different than some other diseases. And that's what makes it so incredibly hard to slow this down, is because people will feel fine, look fine, and have no idea that they're spreading it to others. When I see a business and there's like a coffee store and there's a bunch of baristas in the same spot and they're not masked and distanced, all I can see is it's like watching a car accident from my perspective. You're just like, that could be really bad really quickly. And I hope it goes fine, but they could all be shedding virus and getting each other sick, and then suddenly you have no staff and employees to be able to work. Again, a mask plus distance decreases viral transmission by about 70%. A mask also helps to protect you. So the degree of virus that you get, you're more likely to be an asymptomatic person or a mildly symptomatic person if you're wearing a mask. And so even if you do get COVID, you're more likely to do okay if you have a mask. So again, it's a super useful tool to slowing the spread of it. It's also like the cheapest, right? Like I'm looking at all sorts of hiring nurses and trying to get other things in. Those are much more expensive, and then we don't have money to invest in other things. But a mask is a really cheap tool in comparison to slowing the spread of the disease. On to the next slide, the thing that I wanted to emphasize here was what I've started to call bubble cheating, how much you can have one bubble and you think that's your small bubble, and then you have another small bubble that you think is your small bubble, and how it spreads between bubble to bubble to bubble. So we see this all the time. A friend of mine is super sick with COVID right now, and he got it from his son, who was basically ate in a break room at his bank. And so there they ate in a break room, they took their mask down, that was his bubble. And then this other guy really didn't interact with anyone, works all remotely, but his bubble included his son, who then got exposed at work. And now he and his wife got it, who are both in their 70s and markedly sick. So again, this idea of bubble cheating, you really got to think about who's in your bubble and who's not, and who else they're seeing, because essentially you're exposed to everyone else that they saw, and it can really spread super quickly. This next slide that I just wanted to emphasize was mitigation and how it's kind of a layered effect. I wouldn't tell my kids to go outside in -20 with just a hat. I would tell them to wear a jacket and mittens as well. And so when we have a lot of COVID spreading, we need a lot of layers of mitigation. If we don't have a lot of COVID spreading, we don't need as many. So this summer, interacting was a lot more like walking across a highway or street with like a donkey and a horse and a car going 20 miles an hour. Now interacting, it's a little bit more like running across a 6-lane highway with trucks going 50 miles an hour. There's a lot more risk to our interactions now than there were before. And so we have to up our mitigation to slow the spread overall. And so while it might have just been okay to wash your hands and be able to keep the windows open this summer, now it's a mask and distance and teleworking whenever you can do it, increasing your ventilation, testing at the beginning of symptoms. I will also say the CDC is really pushing for surveillance testing, testing almost on a weekly basis for people who are interacting with the public regularly. And so if you have staff that are interacting with the public regularly in their job, you may consider surveillance testing on a weekly basis to be able to minimize the risk that you have an asymptomatic person who then brings it into the break room and then infects your entire staff. Or another business lost all of their electricians, and so then they couldn't go to emergency generation power. Another one, their boiler room staff all got infected and they couldn't keep their business open. So thinking about who are the other critical people to your business to staying open and having them tested on a weekly basis. There's one study out that shows that if you do weekly surveillance testing for high-risk employees, that you decrease the need for quarantine and isolation by approximately 90%. So again, we want to keep your staff active and healthy and working, but we need your help to be able to identify cases quickly before they affect a lot of other people. And you have a lot more people out because of quarantine and isolation. This is the last topics that I just wanted to touch to. Moving on to the next slide is vaccine and vaccine development. I was on a call yesterday with Tony Fauci in the White House, and he said the cavalry are coming. I have to tell you, it was very reassuring to hear. But the vaccine development stage is at a place that I honestly don't think any of us were fully expecting. We were hoping for a vaccine that would maybe be 50 to 60% effective, and that would definitely slow things down. The two vaccines that are the closest right now, the Pfizer and the Moderna vaccine, are showing between 90 to 95% efficacy. Looking at the data from the Moderna vaccine, they had no one in their group that got the vaccine that got severe illness. So while they did get a small group of people who got illness, no one got severe illness, which was fantastic to see versus the placebo group. And so this is really different. It's kind of like we can see the finish line right now. And I feel like we're all laying down right before the finish line gets there. Like we have this chasm right now of cases and increasing capacity and overwhelming the healthcare system. And if we can just bridge to this point of better vaccine administration, we will be at a very different place. We have a finish line in sight. We have a lot of hope in sight, but we really need everyone to rally together. I'm markedly concerned that a mildly enjoyable Thanksgiving this year may lead to a just devastating Christmas this year. And so as we gather in these indoor spaces with loved ones, I mean, there was a study that said 40% of Americans are going to gather over Thanksgiving with friends and family. And that's the highest risk, is inside with our masks down and being in close contact with others that aren't a part of our household. No one wants to be the person who says don't have Thanksgiving. This is human nature. We need those connections in so many ways. However, finding ways to find gratitude, like Sabrina talked about, and being connected is so, so important this year, but also minimizing the spread. I think the best holiday gift you can give your employees and your family this year is the gift of health. Which is the gift of making sure that we're not spreading COVID rapidly throughout. So finding ways to be creative. My neighborhood is doing a food exchange so that everyone shares something different. I'll be working in the ER because I think finding a way to serve is a way that feels more connected, even though I can't be with my family and friends. And then a lot of Zoom meetings with my family to try to stay connected in a meaningful way. And it's not like hugging my mom, but it's what we need to do at this time for so many different reasons. So there's a lot of information on the CDC website about gatherings in general, as well as Thanksgiving, and we just encourage people to take a look at that. Moving on to the next slide, I'd encourage people to take a look at this winter resiliency campaign. I loved all the awards that are happening. I love the idea of positive deviance and highlighting the people who are doing things well. Valdez has done a really great job of having COVID conscious businesses that they actually give awards to and celebrating the just incredibly creative ways that the business community, I mean, I think sometimes the business calls are my favorite because you guys are like so creative and like thinking about the different ways to do your business in ways that are COVID conscious. We built this resiliency campaign to kind of highlight the things that we all need to do to be resilient this year. I also think about this a lot like the sun. I think it's going to get really dark by winter solstice. And then just like the sun very slowly starts to come back, I think that with the vaccine, we are going to very slowly get to a better and better place. And by spring equinox, we will be at a very different place. And by summer solstice, I think it will be markedly different. That's in my rusty crystal ball, which is not perfect. But I think that sort of kind of like a slow faucet turning on a lot of help on the horizon is coming very quickly. We also have better treatment options than we ever have. And the hospital and medical community has learned a tremendous amount about this disease. And so we have better treatment options. I always say I'd rather COVID now than 6 months ago, but I'd much rather COVID 6 months from now than today, because every day we learn so much about this disease. And the more we can slow it down, doesn't mean that we have to not go outside and be connected and enjoy each other. But it's just doing it with the tools that we have to reduce the transmission and spread to keep people healthy and active. So with that, really having people mask up is huge. I can't tell you how many times I get calls from people who say, I would go to these businesses, I would spend money, but I drove up and they don't have a mask on. And so I'm not going to spend my money there. I think if people don't feel comfortable spending their money in your location, it's going to be hard to get business to back where it was. But if we have people feel comfortable because they feel safe in that region, we are going to do much better at keeping businesses moving forward financially and keeping your employees safe. Spreading out, the more you can do to spread out, particularly that 6 feet distance and keeping our group small. It takes these 3 things, but these are tools that are for you to be able to slow the spread in your community as well as amongst your staff. And so with that, I'm happy to take any questions afterwards, but I'll hand it over to Dr. Brunner.
Great. Thank you, Dr. Zink. Thank you for the opportunity to be here today. As Sabrina said, I love Fairbanks. I'm a lifelong Fairbanksan, and it's wonderful to be here with the chamber today. So I just have a couple of slides that I will go through. You can go to the next one. Couple updates from Foundation Health Partners. So to echo what Dr. Zink said, there are some materials that are available. I put the links at the end of this slide deck. So some materials to support your business and kind of support messaging. So the first one is the Take Care Alaska sheet that you see there from DHSS, and then some new materials from Foundation Health Partners. So similar to the business toolkit that we came out with in the beginning, have partnered with the wonderful PR team from the state, and then with Fairbanks Public Health Nursing here in town to develop some materials that are available. So these are printable materials, and you can go to the next slide. And so the big thing, sort of just to echo again with what Dr. Zink said, I am a pediatrician, as many of you know, so I've got to think of things in cute little rhymes and ways for kids to remember. And so this is a great one that the state has used, and it's really that avoid the 3 C's. So the 3 C's, again, closed spaces, crowded places, and close contact situations. So just a great way to sort of help capture people's thoughts and stick it in your mind. And then the second is avoid the 3 C's, but do the 3 W's. So the 3 W's, to echo again, wear a mask, wash your hands, and watch your space. And it's really, it's not a choice of which one is your favorite and pick your favorite and do that one. It's really sort of layering those things on top of each other and using all the W's, not just your favorite W. And moving to the next slide, I can't tell you how many conversations I am in right now about what about it if an employee is sick? And this is a healthcare employee, this is a daycare employee, this is what if a child is sick? Every day the conversations that I'm going through right now are this, and it is so different than it was in 2019. So in 2019, I would say, here's what you do, and okay, once your fever's gone, then they can go back to daycare. And now I have to stop and wait, okay, how many people are in the home? Where do you think you got exposed? Okay, 10 days from this, now add 14 here, now subtract this. That's all if you don't get sick. If you do get sick, carry the 4. It's a hot mess of how many days. And so it's just a totally different situation in 2020. These are some materials about testing and the testing location. So what are the different types of tests that are available? And then what are the testing locations in Fairbanks? And so these are available to support your business. Again, they're on the website, and it just, again, echoing the importance of early testing. As I'm walking through these cases with our team, I can't tell you how common it is that the first person just felt a little bit crummy for the first couple of days, and then on day 3 or 4 started to feel much worse, and that's when they got tested, and by then have exposed their bubble and their cheating bubble, as Dr. Zink talked about there. So these materials are available as well. Moving on to the next slide, I just want to, this hodgepodge slide was just to say how many different tools are out there. So if you are looking for anything specific, let us know. DHSS, Foundation Health Partners, CDC, partnering with public health here in town, has made a number of these, and these graphics are available and can be used in a number of scenarios. We're using them kind of all over the hospital here and just trying to refresh our messaging to catch people's attention again here. To echo Dr. Zink, what keeps me up at night is really, as healthcare providers, we want to take care of our community. These are our friends, these are our neighbors that are coming in and seeking care, whether it's at the Denali Center or at the hospital or at the clinic here. And what keeps me awake at night is being so busy or so overwhelmed that we're not able to provide the level of care that we want to hold ourselves to. And so really working with our community to try to support the healthcare industry so that we can provide the care that we want to our friends and neighbors here in Fairbanks. The next slide has the links on it to a bunch of these materials that, again, have just come out in the last couple of days. And I think one of the things when I looked through this slide set and talked about it a little bit with our team here is they looked at the slides and they said, wait, there's an end. And they got so excited with the idea of there being an end and there being hope. And so I think just really trying to share that message, and this is for now, this is not forever, and that there is hope and there is an end in sight here. So with that, I will turn it over to questions and look forward to talking to you guys.
Okay, excellent. So we will have Janelle present questions that came through our online chat. And just a friendly reminder, if any of our viewers have questions, just type them into the chat and we will get to as many as we can. So thanks, Janelle. Take it away.
Okay, and the questions are coming in fast and furiously. So I might, in between asking a question, need to furiously go back and forth and try to read through them all. I guess just to start, we still are hearing from some of our business members, maybe coffee shops or other places where they have a lot of customers who are coming in person. That's the only way to really interact with their service. Who say, we're still hearing from our customers, the healthcare community is overreacting. Everyone's overreacting to this. It's just another flu-like virus. Is there any information or advice that you can provide to help those business owners that are trying to keep their employees and their customers safe, to have an informed response that they can give to that type of comment?
Yeah, it's a great question. We hear the same thing on a regular basis. I think it's about meeting people where they're at. And so if someone says, I think this is all overblown, and saying, well, why do you think that is? Then it may be because they don't trust the healthcare community, or because they read something online, or it's because they're comparing it to the flu, which actually may not have been the flu. It may have just been a cold, but it's always amazed me prior to this how many times people said they had the flu, and I'm like, that's not the flu, that's just a cold. And so I don't think people always know what flu is because they don't experience that in the same sort of way. A couple numbers, between the ages of 1 and 15, you're more likely to die from influenza than COVID. If you're less than 1, you're more likely to die from COVID. And then greater than 15, more likely to die from COVID. And that increases exponentially year over year. 71% of Alaska population is considered high risk. So sometimes people say bubble up the group that's high risk. It's really hard to bubble up 71% of our population to not have interaction. And so that includes both age and underlying health factors. Obesity is a really huge risk factor. I can't tell you how many people I've seen that are young, 20, 30, and just a little heavy set and overweight, really struggling to breathe. I think it's good to acknowledge the fact that, yeah, many people are asymptomatic and many people have very mild symptoms associated with it, but it's really hard to know which one isn't. And again, these are tools to empower individuals to make life decisions and to support their community and loved one and friends. And so I think oftentimes starting by a story of saying, I understand you hate this mask, but I'm living with my dad and he's super sick at home or he's at risk. So I really appreciate you wearing a mask in my business because it helps me keep my dad healthy. If there's something that's meaningful to you about why you are choosing these mitigation efforts, or, I know someone at the hospital and they're really stressed about this because of what they're seeing, figure out something that's a story that's personal to you and find why they're pushing back, and then try to make that personal connection. I think just ranting and raving about it only gets us so far. And there's been too much politicization anyway. This is about a community taking care of a community to stay safe and strong.
Okay, thank you for that. So another question, and I don't know who would be best to answer it, but there have been some reports in the media of vitamin D being particularly helpful in boosting people's immune systems and might be part of, preventing people from getting sick. Is there anything you can tell us about that research or where that stands?
Yeah, absolutely. There's quite a few things that you can do to prevent. So again, making sure that your underlying health conditions are well controlled makes a difference. If you've got like asthma that's well controlled. I have a friend who's lost 100 pounds since this pandemic started because he was obese and saw it as high risk. So that tells you, 1, how long it's been going on, and 2, that you think something might not be changeable, but it is. And so taking care of your health. And then vitamin D deficiency clearly is a risk factor for higher rates of hospitalization and death. And so we really encourage people to not be vitamin D deficient. We sent out a blog yesterday, I think it was, on vitamin D and kind of levels and what to be checked on to make sure that you are considering that. Particularly in Alaska in the winter, we have a high percentage of our population that's vitamin D deficient. A lot of traditional foods, including salmon, have really high dosing. So part of it really depends on your food as well as your sun exposure. But Dr. Brunner, what else would you add to that?
So the website that's listed on here does have the DHSS blog that went out yesterday about vitamin D, and it is a great resource for people who are asking questions or looking at it. The other big thing, just remembering again, got to talk about babies, is everybody under age 1 and kids should also be on vitamin D as well, and those doses are on there and available.
Okay, so we have one of our members who actually is recovering currently from having COVID-19, And she was asking about, is there any system for cataloging symptoms from people who have the more mild cases where they're not requiring hospitalization, maybe to help people identify when they have a more mild case, or, because we've heard a lot of symptoms mentioned that do sound a lot like having the flu or something else. So is there a more comprehensive list somewhere of those lower impact cases, what the symptoms really are that people are seeing?
I'm mute, sorry about that. We also had a blog about that and about long-term health effects. So some people call it long COVID, but there's clearly long-term sequelae for some people associated with COVID. It looks like the sicker you are, the more likely you are to have long-term side effects, but that's not 100% not the case. There are definitely many people who have mild symptoms at home and then do get sick later and have these kind of long-term symptoms. There's been a lot of great publications about this, including JAMA had a really good summary of long symptoms associated with COVID. We're seeing clinics on the East Coast particularly set up multidisciplinary teams to address long COVID. We see a lot of mental health associated with long COVID, depression, fatigue, just a sense of it can't get up and do anything. And so not only physical, but as well as emotional. We see higher rates of clotting. So 11% of people who are hospitalized for COVID require readmission within their 90 days. And a lot of that's because of clots that can cause a heart attack or pulmonary embolism. And so depending on someone's risk factors, there may be medication to prevent some of these kind of longer term symptoms associated with COVID. We also see inflammation of the heart. We also see inflammation of the brain associated with COVID, and the degree that this impacts everyone from young athletes to people's kind of cognitive function is still being understood. I would also just point out that we do see reinfections as well. So sometimes people say, well, I got COVID, so therefore I'm good to go. We think that people's immunity probably protects them pretty well for the first 90 days, but after 90 days, everyone gets kind of put back into the same pile, including needing to quarantine if you've been exposed. The data we're seeing out coming from the vaccine looks like you develop better immunity from the vaccine than you do from getting COVID as well. And so I get that question a lot, like how come I have to participate in this mandate or this aspect if I've already had COVID? And that's just because you're at high risk of potentially still getting reinfection. But I'm really glad you're recovering from COVID. I think it's also important to realize that there's no stigma. This is just a highly contagious disease. And so I appreciate you sharing. And I think the more that we can talk about what people are experiencing, the more we can learn from it. But we as a state are not cataloging people's symptoms for kind of long COVID. We don't have really the capacity to do that from a research standpoint, but a lot of that's being done on a national standpoint. Dr. Brunner, I don't know if you guys are doing anything specifically on this.
No, I think the biggest question that I get is sort of surrounding those mild symptoms in the beginning, especially. And it really is that ability to tell the difference between COVID and a cold and stomach flu and bronchiolitis and croup and all the things that we all know children and adults who've had those illnesses, we just can't tell without a test. And so when we look at the symptoms that people have, there are a few more specific symptoms, but really those sort of vague mild symptoms, we just can't tell without a test.
Okay, thanks for that. So someone had asked, there were a couple of questions about preventative measures, maintenance testing for employees, preemptive measures. I know you talked a little bit about that. Can you just maybe clarify, what do you think that looks like in a typical business? What specific steps would that business owner or manager want to take in order to do some of those preemptive measures?
Yeah, it's great because the preemptive measures keep your staff healthy and keep them moving forward and make this doesn't impact you. So first of all, there's the things that we keep talking about, and that's mask wearing, distance, ventilation can be really important, washing your hands, particularly with ventilation with it being hard in the winter. If you have a business and you're struggling with ventilation, I'd recommend taking a look at the EPA website. I think it's the clearest website on what ventilation means and what to do regarding COVID about that. Again, a mask plus distance reduces your transmission by about 70%, and you add good ventilation on top of that. I would have really good oversight over things like your break rooms and places like that. That's where, Laura and I work swimming in COVID positive patients all day long and don't get it because we take preventative measures to protect ourselves. This is a conversation I oftentimes have with teachers, because there's like, oh, I'm going to be in this room and I'm really concerned. And you have to kind of learn to trust your PPE, trust your ventilation, trust the distancing to be able to mitigate your response, mitigate the chance that you would get COVID. So we aren't seeing big outbreaks in healthcare because people are wearing it. Where we see outbreaks in healthcare is when they get in the break room together. So think about the break room. I also would really think about what your employees are doing outside of the work. So, when you're hanging out with your friends and socializing, that may impact our business, and that may impact my ability to keep the doors open. And so asking your employees to work with you, not just the mitigation in the business, but also outside the business. And then layering on top of that, particularly if you have a lot of interaction with the public, some sort of surveillance testing program. Right now, again, the CDC is likely going to come out with recommendations later this week, but what they've been messaging to us is consider surveillance testing once a week for your staff to consider. So, if I owned a coffee shop, I would put up some plexiglass barriers. I would really have as much distance as I possibly could. I would do as much drive-through. I would do delivery these days if I could afford that. And then I go for it. And then I would consider having my staff, and with Fairbanks, there's a 7-day-a-week drive-through test. We see staff will do it for a bit. They get burnt out after having to go on a regular basis to continue to get testing because it's time outside their space. And we're working with particularly bigger businesses and others to do, like teachers and schools, to do surveillance testing on a weekly basis to try to improve that. I think we're going to have more and more availability for testing moving forward. I think if we continue to move into that space and continue to hope to get the turnaround time as quick as possible. But those are a couple other things I would do to prevent. And then again, remember, a mask not only prevents the transmission, but you're more likely to be asymptomatic or mildly symptomatic if you're wearing a mask. So it's another tool you can use to keep your staff healthier.
Okay, and we're probably coming up to the point where we're going to need to cut off the questions. Sorry, I know that we have several that we're probably not going to be able to get to. One question did come in about caregivers, and I know there have been some questions about healthcare workers. Are there any statewide or national standards about, keeping those folks safe or testing for those folks, or is that all really determined by their local employer?
So it's a great question. This is where I think Alaska doesn't fit perfectly with CMS and some of the federal rules. I mean, there's many ways we don't fit perfectly into some of these federal rules. But if you are a nursing home or a long-term care facility, there's actually federal guidance by CMS on how regularly you have to test staff. And that depends on the percent positivity in that region, as well as the number of cases. And that's totally outside of an outbreak. So that is already in CMS guidelines. If you are, taking care of your mother in your house, you wouldn't fit under those CMS guidelines, but it doesn't mean that you wouldn't want to consider following them yourself. And so something to consider as well, including being tested on a regular basis. And it varies between every other week testing to like 3 times a week testing, depending on kind of the level of transmission. So I guess I would just say that it's on our website, but there's a kind of a whole set of testing guidelines. Also, for healthcare workers, if you're wearing a surgical mask or better and eye protection and you interact with a patient, that's not considered close contact for healthcare workers. Part of it has to do with the donning and doffing, the putting on and off. You want to make sure that's done well, and we're trained on how to do that. But I think it just speaks to the importance of a mask plus eye protection. And then if you're actually physically doing caregiving, including like helping move someone or clean something up, having additional barrier protection, such as a gown and gloves while you're interacting with that person is another. There's a whole guidance on the CDC about healthcare workers and protection you should be doing. But if you're caring for someone who's ill in your house, I would encourage you to follow kind of the same guidelines, including protection. I don't know if you guys have ever done like the fun run in Anchorage with all like that powder dust. I just kind of imagine myself in the fun run when I'm at work all day. And then I'm just getting covered in red powder dust. And before I take anything and everything off, you know how that spreads everywhere. And you need to really think about what you're doing. But even when I go out and if I have to go into a state office building or something else, I do the same thing. So I take off my shoes, I take off my mask, I put it in an aerated bag so that it has good air movement so the virus can die. This virus can't live without our cells to do it. I wash my hands and then I go in, my clothes come off, I shower, and then I put on new clothes. So again, just think of yourself in the fun run every time that you're out interacting with the public and cleaning before you move into your bubble. Keep your bubble clean.
Right, and I do know we need to move on, but I think there's one question that did come in that other people might be wondering about, and you're a good person to answer it. Someone was asking about State Health Order number 8, which just came out, which is the one about travel within the state of Alaska. I think there's probably people trying to figure out how to interact with their in-state family or other plans that they had for the holidays. So someone gave a couple of specific examples, for example, going to Fairbanks to Anchorage for 3 days or 5 days. You know, how can people kind of navigate that health order?
Yeah, so big picture, travel is risky. And so this is not the time to be traveling. So any way that we cannot travel, the better off we are. Smaller picture is if you're going to travel anyway, what ways can we reduce the risk of transmission overall? So again, distance, mask, hand washing. The CDC, I think, is going to come out with recommendations later this week that recommends being tested 1 to 3 days prior to travel, and then 3 to 5 days after travel, and staying home 7 days until that repeat test is back, because you kind of need both of those tests on both ends. So if you're going to travel, following something along those lines. Health Order 8 essentially reflects that. However, it's hard to do every individual interaction. The Fairbanks to Anchorage example that you put on there is on the road system, so that doesn't count as part of Travel Mandate 8. It's testing needing before or afterwards. I'm not saying it's not a bad idea. So these are tools to help mitigate the risk to you, and so you can always do more than these tools recommend. So Anchorage to Fairbanks is on the road system. But if you went Fairbanks to Bethel, that would be off the road system. And then Health Mandate 8, which goes into effect November 21st, would affect that. So again, test beforehand, and then not interacting with people until a second test is recommended. And the state one says 5 days afterwards. Again, it's kind of that 5 to 7 days. The modeling. I will also say that if you're having troubles at all and you're moving or you're traveling, I would, again, really recommend people take a look at the at-home testing options, because those you can take with you. You can put them in your travel bag, and then when you're ready to test, you test and you FedEx them in, and usually the results come back in 24 to 48 hours. And so that's set to go. So if you're moving to a new area, or you're going to be traveling to an area and you don't know the testing availability, I mean, it's on our website and the rest of it, but including moving out of state, using one of those at-home tests is a way to protect your family and others. It's this kind of harm reduction and mitigation. We understand that not everyone's going to not travel. And so we want to give people the tools that they can to try to keep themselves and their family safer.
Okay, well, thank you so much. There's definitely people coming in on the chat just saying thank you for the information and for the time today. So I'm going to kick it back to Sabrina for the remainder of our program.
Okay, thanks, Janelle. And I echo those comments. Thanks again so much, Doctors Zink and Brunner. We're so happy to have you with us today. So I would now like to invite Alex Sloat of Vivlamore Companies online for a sponsor spotlight. Alex?
Hello, everyone. My name is Alex. I'm the marketing director for Vivlamore Companies, which of course includes Sunrise Bagel and Espresso. We wanted to sponsor today's luncheon for a couple of reasons. You know, first, because we've made a lot of changes in response to COVID, and in some ways have found a lot of positives in them. So, you know, COVID has definitely been challenging, but it's also encouraged our team to look at our daily practices with a completely different perspective. We've made large changes like enforcing 100% mask policies, you know, temperature monitoring, reducing staff inside the stands to allow for as much social distancing as possible. But we've also looked at the small elements of the business, like switching to individually wrapped straws and silverware, you know, to reduce as many touch points as we possibly can. And we've definitely learned a lot from this year and have certainly grown as a team, and for that we're thankful. And the second reason we wanted to sponsor today's luncheon is because this Friday, November 20th, is Sunrise's 20th birthday. And not only is it Sunrise's 20th birthday, but it's also our golden birthday. So we're celebrating all week long with Facebook giveaways centered around our 6 core values. So please check us out on Facebook and follow along as we reflect and celebrate on the past 20 years of business. And before I move on, last week I sat down with my boss and I asked if he could remember what initially encouraged them to open up their first coffee stand. So way back in 2000, the Vivlamore family was sitting at the breakfast table reading the Sunday paper, and they saw that a coffee stand was listed for sale next to the Naughty Shop. So drive-through coffee huts were just becoming a trend, so they decided to just go for it and buy it, and they relocated it to the Cornerstone Mall. They creatively, their words not mine, called it Cornerstone Bagel and Espresso, and at the time they didn't have a logo or anything. They just had this very early 2000 Snoopy font. which was horrible. So when they eventually decided to expand to more locations, they decided to change the business name to Sunrise Bagel and Espresso. So now there are 8 locations across Fairbanks, North Pole, and Eielson. And I can't talk about Sunrise without mentioning my favorite part of this business, and that is the Sunrise Cares program, which was developed back in 2015. On the 3rd Thursday of every month, so Sunrise donates 50 cents of every beverage sold across all 8 locations to nonprofits. Or lately, it's honestly been holding donation drives. That's been kind of a new thing this year. Earlier this year, we did one for the Fairbanks Community Hospital Foundation, where we donated personal protective equipment to frontline health care workers. I think we ended up raising $5,600 or something along those lines. And the reason why I bring that up is because Sunrise really does recognize that the success of a local business isn't possible without the support of a strong community. So they really make an effort to give back, and that's what I love about them. So a huge thank you to all of you guys for being such an important part of Sunrise's success, and thank you to the Chamber for letting me brag about this awesome business for the past few minutes. Definitely going over my time limit, and cheers to another 20 years of Sunrise.
Wonderful. Thank you, Alex. I love hearing that story. So we are excited now to have Cynthia Ross of Ladies First for a brief spotlight as well. Cynthia?
Hi, everybody. Thank you so much. It's a pleasure to be here. How appropriate today for the spotlight. Just wanted to share with everyone the continued importance of screening. We are Ladies First. We are a statewide breast and cervical cancer screening program housed within the State of Alaska Division of Public Health. And really our role is we help pay for breast and cervical screenings for those women who have financial barriers to screening. And so it's very easy to enroll in our program. We have very generous guidelines, and all that's required is if you are a resident of Alaska, meet our income requirements, which are very generous, and you are uninsured, or you have insurance that has a high deductible that you cannot pay, or if for some reason your insurance does not cover screenings, we are here to help. We are not a medical facility. We partner with people in the healthcare providership, such as BCDC and other entities in Fairbanks and around the state. And we are here today to raise awareness with the business community, because women make up almost half of the business community, and our health issues impact business. And so, as we all know, cancer is a very devastating disease. And it's particularly sad when, in the case of breast and cervical cancer, we can diagnose these early and eradicate these diseases if caught early on. We can detect them and then we can treat them. But in order to detect them, we need to screen them. And so screening is very important. And so we encourage business to share this information with your employees. Unfortunately, so unfortunately, cancer doesn't stop just because we're in a pandemic. And so we encourage everyone to continue to get their screenings. Business can be proactive and play a role here in ways such as you can provide paid leave for people to get screening. You can offer financial incentive for people to get screening. There's a lot of creativity leeway in there. Or you can even host a screening van to come to your place of work. You can bring the screening to you. However you may choose to support, we hope that you will do. Again, we appreciate your support. Thank you for the spotlight today. Have a great day. Thank you.
Thank you, Cynthia. And thank you again to Doctors Zink and Brunner for their special update today. And thanks again to Sunrise Bagel and Espresso. Again, happy anniversary to you all. And thank you also to our community and our membership who have not only joined us today, but who will certainly probably watch online later. Special reminder, we will not have a presentation next week leading into Thanksgiving weekend, and we'll hope you all enjoy a safe holiday. We do look forward to seeing you back on December 1st for a presentation titled Managing and Investing the Alaska Permanent Fund. So thank you so much, and be well, Fairbanks.
Thank you all.